So good morning and welcome to our KD Career Talks. Today we have Dr. Sean Hashmi and we also have Allison Bryant from the USC School of Pharmacy. And we also have a panel, is that correct, Cooper?
I'm sorry, talking with another CDU student. Yes, we have a panel today.
Okay, perfect. So then we also will have the panelists introduce themselves. So let's start with Dr. Sean Hashmi.
All right, welcome everybody. Thanks so much for having me. I am class of 1993. Before you guys had your beautiful campus, we used to have trailers. And this goes way back. I am a practicing nephrologist, that's a kidney specialist. I'm also an obesity medicine specialist, and I work for Kaiser Permanente in Southern California. We are a very large healthcare organization. We provide healthcare and all of the health needs for 4.6 million members in Southern California. So part of my role is also to design weight loss and obesity programs. When I was in high school, I had the chance to go across the street and get a firsthand look at sort of what was going on. That was my first exposure to any kind of healthcare. And at that time, as you may or may not have heard, the neighborhood wasn't as great. We had, unfortunately, a lot of incidents that happened at the hospital. So there was a lot of stuff that I sort of had in terms of coming up. And the big thing that, at least for me, has always been is what I call social determinants of health, or this health disparity that exists. So part of the reason why I wanted to come was if I get a chance to inspire any one of you guys to go into this field, that would be great. So that's me.
Thank you. And then can I have the panelists introduce themselves?
I'm Allison Bryant, and I'm Associate Director of Recruitment and Outreach at USC School of Pharmacy. And briefly, our program is a four-year pharmacy program that prepares future pharmacists for positions in community pharmacy, clinical and hospital pharmacy, government and industry. And our three student panelists, who are going to introduce themselves next, represent three of those areas. So you'll be able to hear research, which I think I neglected to mention in that summary, but researchers, as well as hospital, as well as industry, are represented here today. So just to give you a quick overview, we accept students from any major. We like to have a student body that has a lot of different ways of approaching problem solving. So you can major in college in anything as long as you have certain prerequisites: biology, chemistry, organic chemistry, microbiology, biochemistry, physiology, statistics, and calculus. And because you're all science-based people, I know that those are immediately accessible for you. And those courses will give you a strong foundation for pharmacy school. Other ways that you can prepare: by volunteering. You might even be able to volunteer at a pharmacy as a pharmacy clerk. Certainly in a hospital would be helpful, but any volunteerism where you can develop your communication skills, your leadership skills, work experience is great. Lots of our students who apply to pharmacy school are pharm techs, so you might consider that. Being familiar with pharmacy is obviously a great help, and you can join at 2- and 4-year schools pre-pharmacy clubs so that you can stay up on what's happening in the profession. I'll put into the chat how you can reach us at pharmacyschool.usc.edu, and also how you can look at one of our publications called Results Magazine. And this magazine will give you a lot of insight into what our students, our faculty, and our alumni are doing to drive innovation in the field of pharmacy. So thanks for having us today, and I'll turn it over to, I like to do things alphabetically, so I'll start with Mr. Philmon Haile to introduce himself.
Thank you for the introduction, Ms. Bryant. How's it going, everyone? Pleasure to be here. My name is Philmon Haile. I'm a current second year at the School of Pharmacy. I guess a little bit about me and my background. I'm from San Jose, California, South San Jose, born and raised. I went to school in the east side at Silver Creek High School. where I was a 3-sport athlete. And I mentioned that because, that kind of forced me to learn like time management and leadership early on. After high school, I went to community college in San Jose for 2 years, where I was a biochemistry major. And then from there, I transferred to UCLA, where I was a biology major, and I took on an African American Studies minor. Took a gap year, went back home to my parents' homeland, which is Eritrea in East Africa. Came back to America, started applying to pharmacy schools, and here I am at USC School of Pharmacy in my second year. And a few of my current involvements are, as Ms. Bryant had mentioned earlier, I'm involved in the Student Industry Association. I have goals of going into industry, which is kind of a non-traditional route in pharmacy, but it's there and it's growing. I'm also involved in SCDI, which is the Diversity, Equity, and Inclusion Committee on campus. Yeah, it's a little bit about me.
Hi, everyone. My name is Michelle. I'm actually a third year at the USC School of Pharmacy. It's really awesome to see all of your faces and get to talk to you all today. I'm actually from the Valley, so I was born and raised in Northridge, California, and I went to high school there. And it was actually in high school that I really solidified my interest in research in addition to pharmacy. I went to high school that allowed us to do a lot of different experiments in biology and in chemistry, and that really heightened my interest in becoming a scientist. And even though I didn't know of any scientists as a young person, I had a lot of people who supported me and told me that I could be a scientist. And so I went into college with that interest in doing research, specifically in microbiology. So I really loved bacteria, and I went to UC Irvine for college as a pharmaceutical sciences major, looking for research opportunities. And I was able to do research there for about 2 years as part of my undergrad. Had the opportunity to meet a lot of really cool scientists as well who were just like me and wanted to do science as a career. And so I continued on and applied to USC School of Pharmacy with the goal of doing a doctorate in pharmacy and a PhD as well, because I wanted to be a scientist in addition to a pharmacist. And the reason why I wanted to do that is because I wanted to integrate research into helping patients. I think research plays a really important role in a lot of the drugs and medications that we have today, and in helping us know what's wrong with patients and how we can fix that. And so I really wanted to be part of that process. And so currently I actually do research at the USC School of Pharmacy in addition to doing my pharmacy training. And so it's been a lot of fun. I work on bacteria that are resistant to antibiotics and see why they tend to cause trouble in patients, unfortunately. And so we're hoping to figure that out and help more people. And so some of the other things I'm involved in addition to research, is I am with Samara and a part of our Black Pharmacy Society, which is our affinity group that we started at the USC School of Pharmacy to provide a space for Black students at the School of Pharmacy. So we're really proud of that.
Hello, everyone. My name is Samara. Unfortunately, I'm not as interesting as Michelle. She's doing great things, and I'm glad she's the one pushing our profession forward, because it's not in me to do research. So I'm lucky to be her classmate and to be able to learn from her. As far as filming, I actually see a lot of through lines with us. I'm also from San Jose. I also was a 3-sport athlete as well. After undergrad, in undergrad, I didn't know that I wanted to be a pharmacist. I didn't know anything about what I wanted to do. And I think a lot of that just stemmed from a lack of confidence in myself, lack of reaching out to people. I didn't do a pre-pharmacy society. I didn't do any of these panels. I didn't have a mentor. I didn't know Black pharmacists. And so I'm really glad that you guys are here and being able to hear some of this stuff. I wish I would have been able to hear this at least from high school, at least from maybe even senior year at the most, or at the least, but it wasn't something that was presented to me. It wasn't presented to me at all, actually. And even if it was, I was in the position where I thought pharmacy school, I could never get in. It's a long shot. But after undergrad, I realized that I really wanted the knowledge. And that's the main reason why I came to pharmacy school, specifically for psychiatric medications, because it just kind of blows my mind that something so small as a pill, can change a person's just psychosocial reality, their ability to pursue a livelihood, a career, things past that, and just, maintain family structure and things like that. So it just kind of amazed me that something like as small as a centimeter can just change people's whole lives. And so that's the reason why I'm really interested in psychiatric pharmacy. Beyond that, a big reason that I am interested in psychiatric pharmacy is because I feel I want to serve my own community, my own Black community specifically, minority, the larger minority population as well. But for Black people, specifically Black men who are experiencing a mental health issue, it's more common for them to be locked up or taken off the streets, or their mental health is in the hands of the correctional system. And as we know, the correctional system, it has lots of flaws, and often those encounters with the police preceding that are often fatal, if a Black person is showing signs of mental illness. And so I just find it really, really important to be able to kind of manage mental health before it gets to that point, and to kind of help people in my community and other communities understand the importance of not just mental health, taking care of it, being proactive, but also just educating yourself on it, being educated so you can help others and things like that. So that's why I'm here, or how I got here.
Okay, so let's go ahead and start with the questions. And we can just go in the same order if you would like. So Favor and Star, let's begin with the questions.
Okay, so our first question to you is why did you choose your career or major?
All right, so I guess I'm up first. In terms of choosing careers, when it came to medicine, my family and we grew up very, very poor, and we had a lot of health issues. I had a lot of health issues growing up. But one of the biggest things that I saw where I could make an impact was the fact that when I went to school, I had 50 cents a day, and I could either have lunch with it, or I could use the bus to get back to Gardena, where my parents and we lived. And it was a very difficult choice. And I can tell you, we used to go to county for my sister's treatments, and taking the bus, which took us 2.5 hours to get to Olive Medical Center, was quite hard. And I remember one time we took 3 buses. We were late getting there because the bus was late. And they said no. And we had gone 2.5 hours in the bus just to get down there. The difficulties that I saw in the healthcare system were quite traumatic. And then, when we had our first rotation, I remember going across the street to MLK, and we had an 18-month-old. There was a drive-by, and an 18-month-old was shot. And when they brought the kid in, I was actually in the ER at that time. And I was just a young kid, and I saw all of these things. And when we would get the school bus, there were a couple of times we saw people in cars going by where you could see the guns, and there was going to be a drive-by, and you were going to see it on the news. When you see all of that and you come out of that, you want to make the world a little bit better. And the question is, what can you do? So this whole concept is as you guys are thinking about your careers, think about how you're going to change the world. How are you going to give back just a little bit that's going to make that impact? You don't have to become a doctor. I'm not here to tell you doctor is like the right thing to do. It doesn't matter who you are, what you are. It matters what you do. So as you think about these things, and I want to emphasize, I don't, once again, I'm Pakistani, my wife is Vietnamese. We're a mixed family. We love it. I don't care what a person's color of their skin is. I have two beautiful daughters. I don't care what their gender is. I care what they do. And you guys have the ability to be able to do. You're not bogged down by so many ideas and so many people telling you you can't do things. You can. And that's the goal of today, is for you guys to look at all of us and just be inspired about something. So I lost my sister to epilepsy. She had a seizure, she suffocated, and she died. And I tried to do CPR on her. I didn't know how. The operator tried to tell me, and it didn't work. So my decision to go into medicine started with a very selfish one. I didn't want to feel that pain. I felt like if I could help somebody to not feel that pain, then I was doing them a service. And same thing, I used to come back and I used to tutor at back at you guys all the time. And then I started getting a lot more busier. Now I run a nonprofit called Self Principle. And the concept is based on sleep, exercise, love, food. It's really about how do we help people to get better? How do we let them to live healthier lives? The biggest thing that I see when it comes to diseases, back, hundreds of years ago, if you said who were the people that were most likely to get sick, we're talking hundreds of years ago. There were people who were rich, right? Diabetes was a disease of the rich. Gout was a disease of the rich. Kidney disease, which nobody even knew existed, and what that meant and why people died, was a disease of the rich. It's not. Now it is a disease of the poor. The number one thing that affects Hispanics and Latinos is diabetes. The number one thing that affects African Americans is hypertension. African Americans have a 4 times higher risk of going on kidney failure. And so part of this stuff and part of what you want to learn is you want to learn how to take care of yourself. You want to learn how to take care of your family. Being a doctor gives me the ability to fight those social determinants of health, to fight those Taco Bells and those Jack in the Boxes that still to this very day are in every single corner of Compton. Every single kind. Same thing. You can go in Gardena and you can see Popeye's chickens and you can see everything fried. Yet I have yet to see, and I've been here now, I'm 46 years old. I don't see a Whole Foods in Gardena. I don't see a Whole Foods in Compton. I don't see any one of those changes. So my mission and my challenge to you is don't just let people like us come here and talk. Take this, get inspired, realize that you guys have the ability to change. You're not like us. We get to a certain stage where we feel like it's too late to start over. It's not too late for you. You're beginning. You haven't even scratched the surface. So dream and dream big, and whatever it is you want to get, you will get it. No matter how many times people tell you no, don't take that. I can tell you, I was told so many times in my life I'd never be a doctor. I was considered not to be smart. But I can tell you, I have a secret, and my secret is there's nobody in this world who can outwork me. That's it. I was never the smartest, ever the smartest. And even in high school, those teachers have retired, so I can say this. Yeah, I was told, you're not going to do well. But I can tell you, it's your work ethic that will beat everybody else. 99% of the people out there, the reason they don't succeed is not because they don't have the intelligence. It's just their work ethic. They just give up. And all you have to do is hold on. Imagine if I told you that instead of quitting today, you just held on one more day. All these other people would have dropped out and you stayed. And guess who gets picked? You, because you're the only person standing. So thank you for listening, and yeah.
Thank you. Thank you for those inspiring words, Dr. Hashmi. I think there was a question for you from Mr. Kevin Gomez asking if you perform surgeries.
Yeah, so as a kidney doctor, I don't do surgeries. What kidney doctors do is we do all of the pre-surgical stuff and the post-surgical stuff. So in other words, anybody who has kidney disease comes to us. We manage them with medications, we manage them with lifestyle changes. If you go on dialysis, what dialysis is think of it like a washing machine, right? We hook up two really, really large needles over into your arm, or we put a catheter in your belly, and we basically take the blood out of your arm. This is all your blood in your body. It's going through a machine, getting filtered and getting clean. And then for bariatrics, I do all of the pre-bariatric surgery, which means if we have somebody who's markedly overweight and they need surgery, where essentially we staple their stomach, right? We make their stomach really, really small. Those are the patients that I take care of before and after.
Thank you for that. So I guess a little bit. So the reason I got into pharmacy, when they say like representation matters, it really does. Because I didn't know any doctors. I knew one pharmacist through like my cousin's stepfather was a pharmacist, right? And that was like all the exposure I had to any healthcare profession. So like at a really early age, he was kind of somebody that I looked up to, right? So the initial spark in that was actually when I was 14 years old. Um, before I even started high school, I went back to my parents' homeland, as aforementioned, in Eritrea. I was there for 6 weeks. And there was a point in time where me and my sister had gotten sick. I don't know if it was a flu, stomach flu, something of that nature. We went to the doctor, and the doctor was really hesitant. Like it wasn't hesitant, but he was, he had to delegate what he can give us and what he couldn't. He had to ration, right? Because he had a certain amount of supplies and medications and things like that. So, like, I realized at an early age, like, all the things that we take for granted here. I go to the doctor's office, I can easily get Tylenol, ibuprofen, any type of medication I need to cure whatever I'm going through. And I realized that wasn't the case in a third world country such as Eritrea, right? So that kind of led me to like want to get involved in healthcare, right? And you know, going back to what I said earlier, pharmacy was the only exposure I had to healthcare. So at the age of 14, I told myself I'm going to be a pharmacist before even starting high school. Um, and you know, my my goals of like my way of reaching these goals was a little untraditional in that I was a 3-sport athlete. I always looked at like sports as my way to get school paid for, right? So I actually did track and field in college or in community college. Originally, I had committed to a 4-year college and then I decommitted and went to community college to follow my track dreams and try to get school paid for because I couldn't afford the original school that I wanted to go to, right? So in my time at San Jose City College, I really took my academics very seriously. Told my coach, school comes first. And he was super willing to work with me. And I practiced 3 days a week out of the 5. But in those 3 days, I put in extra hours. I was staying past everybody. I was, staying past my coach even, going to the weight room after in hopes of getting a scholarship. Ultimately, I had gotten that scholarship that I wanted. I had gotten a track scholarship to a 4-year university, a few offers, about 4 or 5. But I had also gotten into my dream school, which was UCLA. And I had also gotten an academic scholarship to my dream school, which was UCLA. So in that moment, I was still kind of like, I want to follow my track dreams. It's so fun. I can be an athlete in college and blah, blah, blah. But I went to go visit UCLA and I really like fell in love with the campus, and I kind of had a moment to come down to earth and realize like, hey, I might not be an Olympian, like this is like, what is the end goal here, right? I can get school paid for through my academics. I can really go for being a pharmacist in this way. So ultimately, I ended up dropping track and field altogether, and I had followed my academic endeavors, which was pharmacy. So, I mean, that was the greatest decision I made because here I am, right, at USC School of Pharmacy. Um, so, you know, that's kind of my route to getting to where I am. I mean, I share a lot of the same sentiments as Dr. Hashmi had mentioned. We're all capable of getting there. All of you are 100% capable of getting there. And it's really that work ethic that separates you from the next person, right? So just keep grinding it out. Those days you feel tired, weary, just remember you got to go another day, another 2 days, and you'll get there.
Thank you so much for sharing your story, Pomon and Dr. Hashmi. I think my story is a little bit similar in the sense that I didn't have any Black pharmacists or doctors to look up to. My parents are actually immigrants, so they're from Nigeria, and I'm the first generation to be born in America. So I mean, they didn't really know anything about, the school system or how to become a pharmacist or do research. They actually had never heard of being a scientist as a career. And the only reason why I looked into that was because in elementary school and in middle school, I loved science so much. And I would always go on the internet and just kind of read stuff. I was kind of like a bookworm. And the things I would come across, I would see like women who were scientists in history and who would go on to do great things. Like one of my favorite scientists was Marie Curie. I don't know if you guys know who that is, but she is this really famous scientist who discovered radioactive particles that would go on to do a lot of things and provide the energy that we use today. And so in reading stories like that, I thought like, wow, I could do something with this passion that I have for science. And my interaction with pharmacy was actually through drug commercials, because my interaction with pharmacy, I thought that all pharmacists were just this like person behind a counter at CVS, and they just give you medication to help you feel better. And so through like watching like TV drug commercials with my dad, I was like, who makes these drugs that people take, And I would, look this stuff up, and that was my exposure to like the pharmaceutical industry and the role that pharmacists play in not just like giving people medication, but how they can also help in the development of those medications, and also in helping doctors manage patients and make sure that they're on the right medication. So that kind of combination of realizing that I could be a scientist, well, I could also be part of helping people through pharmacy in high school really encouraged me to start pursuing like research. And I didn't really have anyone to tell me, oh, hey, Michelle, like this is what you need to do to become a pharmacist. I had to like research stuff online on my own, and that's how I recognized that I needed to go to pharmacy school to become a pharmacist, and that I needed to get a PhD in order to become a scientist. So I was like, well, why don't I do both of those? And so I was this little spunky, ambitious girl in high school telling my teachers I wanted to get 2 doctorate degrees and to do research, something that I had never seen anyone do. But I had a lot of people tell me that, why do you want to do that? Why don't you just become a doctor? Why don't you just become a scientist only? Why do you want to do both? And I had a hard time explaining to people, why I was passionate about both of those things and why I believed that they could go together to help people. But fortunately, I had people who did believe in me in college, and I was part of this great research program that helps minority students learn about science. Learn how to be researchers, learn how to talk about the science that they're doing and be excited and encourage them. And it was through that I gained even more confidence to apply for pharmacy school and for a PhD program and continue the research that I'm doing. And so I'm really fortunate to have met people like Miss Allison Bryant at USC School of Pharmacy, like Samara and several classmates I film on that are pursuing like what they're passionate about, and together to support each other in what we're doing. And so now I can say I'm learning how to become a pharmacist and I am a scientist, which is super cool. And I want to help you guys, students like you, realize that don't dream too small. Like Dr. Hashmi said, anything that you see or feel like, oh, that would be super cool to do as a career, go after it. I want to tell you that there are people like us and that you will encounter that will support you, that will help you move forward. And even if there are people who say no, because I also had a lot of people tell me, you're never going to be a researcher, you're not a good scientist, you're not going to get into pharmacy school. Because I did all the things that Miss Bryant was talking about. I didn't volunteer at a hospital. I didn't become a pharmacy technician. I didn't know anything other than what I saw on TV about pharmacy. But I had this dream and this vision in my mind, and just kept pursuing it and kept sharing it with people. And that's what brought me to where I am today. And so I want to encourage you, fight those naysayers. And if you have a dream to do science, especially the girls on this call, if you have a dream to do science or do medicine, don't let anybody tell you that you can't as a woman. You are just as smart, just as powerful, just as capable as any other person to follow your dreams. And I want to let you know that it is possible. Even the crazy things that you can think of, like me, like a clinician scientist as a woman, you can do it too. So, yeah.
Thank you for sharing, Michelle. Excuse me. I definitely echo a lot of that. When I was considering becoming a pharmacist, I also thought, there's no way, there's no way I could ever get a doctorate, a PharmD. That's, for lack of better words, I was like, that's wild. That's just, it's out of my scope of my vision for myself. And so I also ran into a whole bunch of people who, and whenever you hear this word, just, take it as an insult. So people would say, why don't you just do this? Why don't you just do that? No, it's not about how other people are perceiving you, but rather where you see yourself going. And what I mean by that is, if you have a vision, the hardest part, there's two hard parts. The first part is understanding what your vision is or what you want it to be. But the harder part is sticking to it and finding a way to have support for you to be able to stick to it. Because like a lot of my other panelists have said, if we can make it, you guys can definitely make it. And it doesn't matter what field it is. It doesn't matter if it's even in the medical field. Just be stubborn. And when people say, just, take that as an insult and just use that. For me personally, I take insults as motivation. Even when I got to pharmacy school, my mom had made this weird comment that just kind of threw me off guard a little bit. I was telling her about, this was after I had gotten to pharmacy school, and I was telling her about some accolades I was making and some achievements. And she was proud, but she used the terminology, I'm surprised because you're not the cream of the crop. And even to hear that from my own mom is like, that, it hurts. So, but I took that as, oh, I'll show you. I'll show you. So that's what I've been doing. I take everyone who says you can't do that, watch me. I'm gonna do it. And if I can't do it now, I'm gonna find a way. And so that's kind of going back to the original question, why did you choose pharmacy? When I say I did not think I would make it, it was such a long shot, but I had to try. I had to if I didn't try, I would have always been in that what if. But all of through undergrad, I was doing not the easy way out, but I did everything to avoid a medical field because I just didn't think I would make it. So it didn't come until pretty much my last week of senior year, where I was like, all this time I've been in my own head, telling myself what I can't do instead of trying, and letting other people tell me what I can't do. So after I graduated, I made a plan. I had done no prereqs because I thought there's no way. And so I went to a community college, did all my prerequisites, and it's not a typical path that I took. Most people are able to have that vision in high school, complete everything, the prereqs in undergrad, and then just go straight to pharmacy school or to whatever field. But for me, I had to take those prereqs after. But for me, I think that was the best thing for me, because as different as it sounds, I learned a lot more in my community college days than I did at my university days. And I think a lot of that was to do with, in my university days, the classes were huge. And so I would just hide because I didn't have a goal. I just wanted to get a degree and see where that would take me. And so when I went to El Camino, it's, very small student body, and you have that interaction with a professor. And it's really those relationships with those professors that can really kind of guide you and kind of mentor you and to where you want to go. So my biggest advice is look for mentors in the most unconventional places. Like, it could be someone you had just met at Target who had just made a comment to you. It could be someone who said, "You're not the cream of the crop." It could be anyone. So my advice, find what you want to do, make a plan, stick with it. If it doesn't work, if you can't find a way to do it, you can, shoot for your next goal, and there's nothing wrong with that. There's nothing that says what you set out to do has to be your ultimate goal. But I think as long as you try for that, it'll pay off, because then you can possibly see if that's not for you, you can weed out that and explore other options. So I think I didn't really answer the question about why I chose it. I think I spoke about it a little bit before, as it alludes to psychiatric pharmacy, especially within our community, but also other, as Philmon and Michelle said, just that representation really matters. Even I fell victim to, I wouldn't go to the doctor or pharmacist or anything because the mistrust that comes from years and years of our people being subjugated to all these unethical experiments and being sterilized and having credit taken away from us. And so I would avoid going to the doctor. And so that's a big reason why you have to become what you need to, you have to become what you needed back then. And that doesn't just apply to your career, but also as a whole, as a life experience. So let's say if you didn't have someone who was supporting you growing up, be that person. Once you grow up, be that person to support somebody else, because you never know how big of an impact you can make on somebody else, and you can change their whole trajectory of their whole life. So yeah, I'll cut it there.
I just wanted to say that I love hearing our pharmacy students talk about their individual paths. Samara's illustrating hers, as well as Michelle and Philmon. They have all come to pharmacy from different directions. And that is so true. Whether you go to a community college to start or to finish your prereqs, whether you have an idea in high school that this is what you want to do, whether you start off and you're looking at your goal of just, hey, this is my undergraduate school dream and what you're going to do from there. There's a lot of different ways to come to it. And all of them are correct. They're all correct. And so keep that in mind, that whatever your path is, as Samara was saying, it might tell you what's not for you, you know, as well as what is for you. As Michelle already illustrated, she already knew. And Philmon took the steps to find out. So there's much that you can do in pharmacy and much obviously in medicine. It was so great to hear Dr. Hashmi talk about his path and all these inspirational words. And just wanted to thank you guys for having us. And keep in mind, there's so many different ways to reach your goals.
Thank you all for sharing your experiences. I'm not sure if you can hear me or not, but the next question is, could you tell us what the general salary for someone in your position or career looks like?
Sure. So for physicians, the range is quite variable. A pediatrician, for example, starts off making about 150 to 200,000, versus somebody like a neurosurgeon ends up making about $1 million. So that range varies, and it really depends on how much you're working and so forth. What I do right now in terms of my field as a nephrologist, I make about 360,000 a year. So I think about that number, and I think about those days of quarters, and it's quite a bit of a difference. But I'll tell you, my ways of spending haven't changed. I still love my Walmart. I think it's the best store out there. I have a Target down the street. I love Target. I don't do any shopping in the malls. Uh, Keep in mind, when you're thinking of a profession, don't let the money be your guide. You'll get thrown around in all these fancy numbers and stuff like that, because if you're miserable, it doesn't matter how much money you make, you will absolutely be miserable and you will hate every day. For me, for example, right now I'm actually transitioning. I'm looking at my nonprofit work, selfprinciple.org, and I'm trying to build that up because I want to give back to the world and give back to the community. So it's a fascinating thing, and I'm mid-career. I'm in my 40s now. I know that sounds like really old, but I was at your age once. But what I would say about salary is salary is very variable. And then the last thing I would say, if there's one piece of advice that I can give you, and remember, this is a medical person giving you this advice, so take it with a grain of salt. But if you do any kind of work, take as much of that money and put it into a Roth IRA. Go home, ask your parents, what the heck is a Roth IRA? Some bald headed dude just told me to do this. It is the most effective thing you can do right now. What's really interesting is, and this is not a lecture on finances, but if you learn the basics of investing, and what we find is people who come from lower income families and lower income neighborhoods, they never invest, right? And this is fascinating. The concept is, what is the difference between a poor person and a rich person who goes on vacation? It's very simple. A rich person goes on vacation, they come back richer. A poor person goes, they come back poorer. You know how I know? When I was a kid, we couldn't take any vacations. We never had money. We went to Disneyland once, and it was such a big deal. And we had never gone anywhere, and we went and we lost where we parked our car. We spent 3 hours trying to find our car, and we had this beat up Chevy that my dad had. And that was it. That was like our big trip, and we didn't take any vacations, and we couldn't afford it. So that little idea, and my father is the hardest working man I know. He never invested. He didn't know anything about it. Nobody was there to tell him. So that single piece of advice that you can take is to invest early. This is not buying stuff. Look, you buy an index fund and you're done and you're set for the rest of your life. It's very, very simple, but you got to make money work for you. You do jobs because you love what you do. If you want the money to come in on the other end so you can really do what you love, invest a little bit. And at the end of the day, money does not bring you happiness. It's actually not true. It brings you happiness if you make more than 75,000. That's the limit, right? So studies show if you make 75,000 or less, if you make more money, you'll be happier. After 75,000, it does not add to your happiness. There are certain basic necessities that you need. Once you fill those, and this research is around 75,000 years ago, it's probably a little bit higher now, but once you get that amount, no more happiness comes from money. Only lots of people trying to take it away from you.
So to answer on the PharmD side, it really does differ for us as well. I'm actually not sure the starting rate right now. I believe it's somewhere from 120 to 150 starting. Maybe my classmates can correct me, but I think that if you do specialize, you have the ability to earn even more because you're the expert in that field. And one thing that I don't think we've touched on yet is there's so many fields within pharmacy. Just like Michelle's doing research, I want to do psychiatric, Philmon wants to do industry. If you specialize in one of those areas, you have the ability to make even more money on top of that baseline. So
I would also say it also depends on what you're doing. So, like even with for Samara, even within psychiatry, there's like so many jobs that she could potentially take, and so that's where the salary also varies as well. For me, in research, I could work for a company or become a professor and work at a school, and so with that, there comes different. Um, salaries, but all of them, I think the starting, you were right, Samara, is like around 120, 150. But I also want to emphasize what Dr. Hashmi said. Learn how to invest your money. It is so, so important to learn how to manage your money early on. It's something that we're not taught in school. And so if you have like a teacher that you trust or a community leader that you trust, ask them about investing, ask them about how to manage your money, how to start a savings account. All of these things, I really wish I had paid attention and knew in college because it definitely helps you further down the road. And it's not just you, but your future families, right? Future families, future any kids if you want kids, building that future and legacy for yourself is super important.
And if you enjoy reading, or not even if you enjoy it, if you have time to read, I suggest picking up books on investing. This is a really good one right here. It's called A Random Walk Down Wall Street, and it kind of breaks down investing. And I'm working on this one too. It's called Seven Figure Pharmacist. So yeah, books are a great source of knowledge around things that you want to learn more about.
and I also want to say there's nothing wrong with having a side hustle as well. Um, Different streams of revenue is never a bad idea. So even if you have something that you're that you can make into, if you can make money off of something, do it. And that can, you can invest that and be able to have more opportunities just from doing something on the side.
Okay, so the next question is, what was your career like before COVID-19 and how has it changed?
For us in healthcare, COVID-19 probably was the single greatest, most devastating thing that has ever happened to us. Um, the number of people that we took care of that passed away under our care, the amount of healthcare workers that we saw also pass away because of COVID-19, it is probably the hardest 12, 15 months that we've gone through ever. In terms of the big changes, some of the big changes that you're going to see in healthcare in the future is virtual, like we're doing now. There's a lot more healthcare going to be delivered virtually. There's this concept of hospital in the home, which is basically trying to get patients to have their care in their own homes. Studies show that if you're able to stay at home, you recover way faster than when you come in the hospital. So COVID is changing all of that. We are able to now deliver all of the antibiotics, all of the IV medications, whatever it is that the patient needs. We have doctors going, we have nurses going, and thanks to all of the technological innovations that are occurring, we can have so much of the equipment in the home. You know, there's companies like Best Buy. People think Best Buy is an electronics company. Best Buy is really a healthcare company, right? So what Best Buy does is they have all of these cameras that allow you to be able to track, let's say you have elderly parents, they want to stay in their home. They can track their movement. They can even tell if they're standing or if they've fallen. They can tell when the last time they opened the refrigerator. They can tell when the food is running out inside the refrigerator. All of these little basic things that we take for granted, they're all available now. This concept of AI or artificial intelligence, which people make such a big deal out of, smaller versions of AI are already being used, and the more they're used in the home for basic necessities, we had the CES show showing the new Samsung robot vacuum that's able to also load the dishwasher. These little innovations that we take for granted, that's going to be our future. That's going to be your future. So think about all of those things when it comes to that.
I can talk about pharmacy and how COVID affected pharmacy. So actually, I would say COVID has put pharmacists at the forefront. You guys may have heard on the news that pharmacists are the ones giving a lot of the COVID vaccinations. And it's been a really great opportunity to show the world that pharmacists are more than just drug pushers at the store, and that we're actually capable of doing a lot of things. But COVID-19 actually put a lot of pharmacists into high gear. We had to learn how to help patients like through video chat. So through using electronics and things like that for pharmacists that typically work in the hospital or in clinics. And for pharmacists that work at those stores like CVS or Ralph's or Walgreens, they had to be put into higher gear, right? There was a period of time where we had to fill multiple prescriptions for people when people were staying at home. A lot of pharmacies deliver now, so they deliver medications and things like that. And then, of course, giving vaccines. So a lot of us, including the students who were recruited to give vaccines to make sure that your parents and your family members were vaccinated and safe against COVID. So for COVID and for pharmacists, it actually highlighted a lot of things that we actually already were doing before COVID. And it just helped us to give back to our communities even more.
So the next question is your workplace people-oriented? And if so, how do you maintain good relationships with your coworkers and or colleagues?
So I'm not currently working in a pharmacy, but I think what can apply to many jobs and circumstances in life even is working on those soft skills. So being able to kind of connect with your employees, your colleagues, even something as simple as, oh, how's your dog, or the vacation you just took, being able to connect with people on a level that's outside of work and have somewhat of a mutual just friendliness. If soft skills are really what we've learned, that soft skills are really what takes you the furthest. Like, everyone in our field is smart already. We wouldn't be here if we weren't capable. So they know that we're qualified to work, but getting along with each other and kind of facilitating that workplace culture comes down to how you act and how you react to things, because you can't control how other people act, but you can control how you react. And so really working on conflict management, those soft skills and things like that are really good skills, not just for the workplace, but for life.
Okay, so if you may, feel free to share any anecdote or anything that you would like to share, like advice, words of wisdom, anything.
I would say don't stress too much. You guys are so young, and I think you have a lot ahead of you. I think starting in high school, there could be this pressure to, um, you're starting to think about your careers and think about so much. But I also want to encourage you guys to enjoy the process too. Things, as Miss Bryant so cleverly said, your path can look a lot different from the people around you, and be okay with that. That's totally fine. I think sometimes as a student, I would get caught up in like how everyone else was doing things, how everyone else was applying to grad school, or how everyone else was getting through pharmacy school. And that brought a lot of stress and anxiety to me. And so I want to encourage you to, feel comfortable in your own skin and the path that you're taking, that it's okay if it looks different from the people around you.
Yeah, and going off of what Michelle just said now, like this journey can feel draining at times. You can feel tired, you can feel worn out. And I think it's super important to have a solid backbone or people you can, fall back on, or, just have candid conversations with along the way, right? Because this is not a journey that you can, a lot of these journeys are not a journey that you could just do on your own, right? I kind of used to be on that, like just keep my head down, study for 12 hours a day, and I'm gonna get through this. That's not really realistic, right? You need a team. You need people you can confide in, right? And you need to practice vulnerability, um, and ask for help if you need it, right? Because everybody in this position right now has asked for help and gotten help. None of us have gotten here by ourselves, right? So that's my piece of advice. Be vulnerable, ask for help.
I think that's really good advice. Me personally, I have a big problem with being vulnerable. And that's probably why it took me so long to even pursue this degree. So that's fantastic advice. I would also add on, there's many things I can add on, but I would like to say, take care of your mental health. If you are pursuing a degree, it doesn't matter what degree it is or what career it is. If you're not taking care of yourself, 9 times out of 10, it's going to be a lot harder to pursue what you want to do. It's going to be a lot harder to wake up every day motivated to do what you need to do to get to that goal. And even past that, once you're in your goal or in, your program, it has to become a priority, because you're balancing a lot. You're balancing school, you're balancing work, there's other extracurriculars. You want to stay in shape. And all of these tend to, especially not just in undergrad, but in higher education as a whole, I feel that students tend to prioritize schoolwork and, getting those letters of recommendation, instead of taking care of themselves. But if you are looking to be in a profession that helps others, such as in a medical field, if you want to heal people, you have to be healed yourself. And so it's important to kind of be able to take a step back and see how you're feeling. And it's okay to take a break. And even this last week, I admittedly should have been studying for oncology, but sometimes you just need a break. So I've been going to the beach, I've been riding my bike, I've been reading books, and I really like to clean. So my place is spotless now. But all of that to say, make sure you make time for yourself, because the path that you choose probably won't do it for you. So you have to advocate for yourself, stand up for yourself, and make sure that you have the kind of autonomy and kind of just insight that you do need to take breaks sometimes. And like Michelle said, you can't do everything that everyone else is doing because you're not them. And it's, in my opinion, being individualistic is what will take you far in your career, because you should always let who you were before you start your education or anything in the educational field. You should always bring who you are as a person into that field and let that kind of inform how you'll be a practitioner, a clinician, scientist, however you want. But don't lose the parts of yourself that are really important to yourself just because you feel like you have to make a goal, make it to your goal. I'm sure all of you have heard of code switching and all of that. And I just want to say, there's times where you do have to be professional and know how to apply that code switching, but try to retain who you are at the end of the day and let that ultimately inform how you are as a person.
Star, I wanted to, oh, sorry.
So
Sorry,
sorry, because I'm loving listening to all of your responses. Um, and I know our students are as well, but we are actually have run out of time, and the students need to move on to their to their break. I know if maybe some of them want to stay and or finish, because I know there were questions also in the chat if you were able to answer those. But I just want to say thank you so much for answering the questions, but going beyond. Honestly, you went beyond from what we asked, and you gave us even more. And I am so grateful that we have recorded this so that we can even share with more students. Um, but yes, I just want to go ahead and say thank you, and the students are thanking you on in the chat as well. Um, so what I'm going to do is I'm going to go ahead and just